Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. For today, we will continue with therapeutic communication. So our session today, it will be about communication with older adult. It is chapter number 19 in your book. So in this session, we will cover those three objectives. The first one, we will discuss the concept of normal aging. Then we will describe the assessment strategies with older adult and discuss the assessment and support intervention for cognitively impaired or adult. So those are the three objectives that we will cover in this session. In this session, what it is about older adult. So what we mean by aging. Aging, it is a process, is normal physiological process accompanied to a greater or lesser degree of changing in the person physical characteristics. So with aging there are the different kind of changes in our ability, but it differs from person to person. Those categories of changes, what is meant, this is the meaning of aging, so the changing in appearance and energy level. By aging, our energy level mostly it will be declined, but also it depends upon how active we are. So mostly those who are active, they are more, doing their physical activities. They will remain more active for a long period of time in their age. Appearance and energy level, it will be affected here. Our appearance, our physical appearance, it will be changed. The facial expression, the skin itself, loss of fatty tissues from under the skin. There are many physical changes which will be there. Weakness in our body system also, it might be there. Decline in the capability of the heart, the capability of the renal system. Sensory losses also, it might be there. Diminished sensory level, decreased functional capacity related to mobility also. The ability of the person to move and do exercises, it will be affected. And it is relatively according to how active the person is, and if he is affected by other diseases or not. Older adult is broken down into three cohorts. Young, old, they are considering young, old from the age of 65 to 74 years old. Old from 75 to 84. Then the oldest old, which is starting from 85 years old and above. There are many changes that will be happening due to aging. Changes in our behavior sometimes, changes in our physical ability, changes in the system and the ability of the system to do its function. So there are many changes that might happen. The aging process, it will reflect also the many factors. So it will reflect the genetic makeup of the person. So according to our genetic makeup, the appearance of aging also different from genetic or from person or from side to side, and from according to the background of those people. Also, life experience in our life and how we are dealing with that. Our personality also it will be affecting. It will reflect also the environmental factor that we are living in. It will affect also the cultural factor. So there are many things that it will be affected by aging process. So the aging need to not to be a negative experience. So some of the people they are taking the aging, oh he is getting aged, so it is a negative expression toward those people who are having, who are becoming old. But it should not be taken as a negative experience. Older adults have more time and less responsibility usually, so they are having more free time because mostly they, after the age of 65, they are not doing work, they are retired, so they are having a longer period of time, free time that might be used and utilized in different activities, and different, it is depend upon the person himself and the healthy level of them. Their time, there is a time, they might have a time of for travel, but it depends upon also the how wealthy is he, how healthy is he, the economic state of the that person. So some of them they are taking it as a chance for traveling and exploring other country and enjoying their life. Engage in activities, other activities like in doing some activities for charities, for other activities that it will help others. Also develop new interest, so and changing the type of interest that he was working for a long time, period of time in a certain issues. Now he might change to the interest because he's free for that. Taking active role also in the community activities, so they can take an active role in because of the experience that they are having, so they can take an active role in the community and helping their community in the thing that he can help. Also, so share their talent with others. The contemporary older adult, they are having low risk of disease and disease-related disabilities, and there are many factors that might interfere with that, which is the development of a healthcare system and the healthcare that is provided for the people. High also mental and physical function, and the mental function also it can be maintained in many of older adults. Active engagement with life, so they can be active, they can still engage with life, they can help themselves, they can be productive, they can be responsive, still responsible, and helping others. Now, after the age of 60, people are more vulnerable to variety of age-related disease. So this is also life, and in some people, they might have many kind of diseases might be related to the age, and it might be linked with it. So cancer is one of the diseases that is related to age, and the possibility of cancer is increased by the getting old. Also, cardiac disease. Cardiac disease, yes, it is linked with our lifestyle, but also it is coming also, it will be more aggravated if it is with lifestyle and the aging. Uh, Aging also, they might be exposed to stroke, especially if they are having diabetes or hypertension, uncontrolled diabetes, uncontrolled hypertension. In this case, the age and health, they might have stroke, which is cerebrovascular accident. Also, degenerative bone loss. Also, it might be there with aging, and which might lead to pathological fracture, especially fracture of the head or femur. Loss of control on body system, they might lose the control in the urination or fecal passage of feces. So those problems, it might come with aging, but it is not on all people. There are percentage of people who might get that, especially if they are having some diseases that is progressed and not treated, or it might be related to other health problems like hypertension and diabetes. Hypertension and diabetes, if it is not controlled well, if the lifestyle is helping that also by having bad lifestyle, also sedentary lifestyle and eating too much, all of those, it will alleviate them. Now we come to the assessment strategies with older adults. In an older adult, we have knowing what to expect help that the client decrease anxiety and build trust. So we want to build trust with them, and we want to decrease their anxiety. So we have to know what are the things that might help them to reduce anxiety and build a trust. So we have to assess the level of anxiety and the causes of anxiety. Continuity of care with one primary caregiver help in development to the nurse-client relationship. So there should be a primary caregiver, and if one nurse is a primary caregiver, or from the relative also there is a primary caregiver that we can link with him, we can communicate with him, we can train him also in dealing with the client. This will be helpful. Establish supportive environment before conducting a formal assessment for the client to be more responsive. So we have to prepare the environment to increase the patient ability to communicate with us and to prepare for the communication in order to assist the client properly. Provide structure to the history-taking interview by explaining the reason for it and what will be involved. For everybody, before doing anything for them, we have to explain why we are coming, why we are there, why we are going to do this assessment, why we are taking history from our client, why we are asking those questions. So in order to when the patient feel that he will get a benefit from those information, he will be cooperative with us and he will give the proper information to us. So ask the client also to share something about themselves and their life. It will help to establish the rapport and increase the client comfortability. So if we ask the client to share to tell us about themselves, to introduce themselves to us. Also, if it is sometimes if we have a group therapy for those clients, for those old age people, when they are introducing themselves, where they were working, what's their experience. In this case, they will share their experience, and also they will feel more relaxed, to give more opportunity for others to communicate with him. It will give also knowledge for the nurse in order to how to deal with that client. Nurse also should get to the client as a person, not as an old adult. So we have to deal with the client as an adult, as a client, not as a patient who is having old age and multi-disease, multi-complaint. So we have to deal with him as a whole person, as with dignity, with respect. So help the client identify the source of social support. Also, in each community there are some social support institution that help the older adult if they are in need for help. So it might be an association, it might be a club, it might be a governmental institution or governmental office. So there are many institutions that might help, and they are providing a different kind of help for older adult. Like it might be a club for those older adult. It might be an association that can provide them with some equipment which is needed for their life or for their use or according to their disease, like electrical bed, like walker. So it depends upon the patient need and the institution that provide. In assessment strategies with older adult, the communication guide to assessment interview, the first thing, when we want to do assessment, the first thing we have to establish a rapport with our client. Try to know his name before, try to call him by his name, or try to ask him, what's the favorite name that you want? I am your nurse, or I am the healthcare provider for you. So what's the preferable name that you want me to call you with? So by that, it will give a support to the client, and it will show a respect for that client. Use open-ended question first. Can you tell us about your life, about your health problem, about your concern, what we can provide you? So those also, it will give the patient a good opportunity to express himself and to tell the nurse about what he is complaining and what he wants, what his history, so everything. Followed by focused question. It depends upon what you pick from the person. And when you are asking an open-ended question, when he answers you, in this case, according to the answer, you can pick some focused question. Like if he said that, yes, and also during those period of time I am having pain and I couldn't sleep because of that pain. So in this case, you have to focus on the pain. What kind of pain that he is having? What's the side of the pain? When he is feeling the pain? So all of those questions, it is a focused question that you have to ask them, which is coming, you will pick them also from his answer of open-ended question. Also, ask one question at a time. Whenever you are communicating with a client, don't ask many questions at the same time. Ask one question. After you get the answer, then you can ask the other question. Bring out a client perspective first. So, how he is perspective, what he is expecting. Then we will tell them. Elect family perspective also, if indicated. So we have to see what's the expectation of the family from our side. Invite ideas and feeling about diagnosis and treatment. So we have to see what kind of treatment and what kind of diagnostic procedure that they are in need for. Acknowledge the feeling and emotion, acknowledge their feeling and emotion and support them also. Communicate a willingness to help. So you have to communicate that you are there in order to help them. You came in order to help them and to solve their problem and to find a solution. How we can get that. Provide information in a small segment also, because sometimes some of them, it is depend among the client himself, because some of them they have affection of intellectual abilities. So you have also always to start with the small segment. Summarize the problem or condition discussed in the interview. At the end of the interview, you have to summarize what you pick up, and in order to validate with the client and the family for accuracy. After summarizing it, you ask them, is the thing that I am giving you a summary according to your case, is it, do you want to add, or is there anything which is different than what I understood? Provide contact information for further question and concern. So you can give sometimes your phone number or your the address of the institution that you are coming from, that whenever they are in need, they can come and contact for help. Assessment of sensitive issues. There are some sensitive issues when dealing with an old adult that it is not easy to assess them directly. Some of older adults, they are having the feeling of loneliness, and either because they might not have a relative, or they might have a relative, but there are some kind of negligence from the relative. Yes, some of the old adults, they might have their children, but they are living away from him. He is alone. His wife died, or if she is a lady, her husband died, and she is living alone. Always, she might not have a relationship with the community around her. So there are many things that, because of the health problem that he is having, like because of impaired vision or impaired hearing, because of that he feel isolated and he isolates himself. So there are many causes which lead to loneliness. Abuse and negligence. They might be neglected from the family or from the caregiver, and they might sometimes be abused by forcing them to do something for the benefit of those who are living with them. So they are abusing them. Caregiver burden. Sometimes it is the feeling of the older adult that I am giving a burden for the caregiver, for my family, because it is a heavy burden on them because of my present, because of my illness, because of the care that they have to do for me. So it might be from the side of the client, but here we have depend upon how the caregiver and how the relative are willing to give a care. But sometimes the burden also it might be economic burden, that they need many drugs, they might need or medication, they might need also many things for their care, like napkins, like other things for their care. So it might be also an economic burden. So in this case, we have to alleviate that by the support from institution, either governmental institution or social institution that might help in this case. It might be also fear of death from the side of that client, that yes, I am getting old, I am getting those diseases, and I am nearly waiting for death. They might have also memory loss. They might have incontinence and the related problem which is related to the incontinence, like also might lead in this increase the possibility of bed sore. Sexual dysfunction, it is common in old age also. Well, it is those problems, it will only be discussed within the trust by relationship. So the patient, mostly, he will not start with discussion of those problems unless he feel that you are a trustful person, that he can discuss those issues with them. Sometimes also he might hide some of those problems, even if they are neglected from the family member or from his son or brother, because at the end they are their family, and when he is talking about them, he feels shy, he feels that he is talking about something from his body of the family. He is dealing with some, this is a sensitive issue. It is not easy to talk about it. So, assessment of sensory changes related to age, mostly in about the sensation, the hearing, it will be mostly affected. Hearing loss start at the age of 50 due to loss of hair cell in the organs of corti, affect a high frequency sound. So the sound of F, S, F, sh, sh, it will be affected. You will not hear them well. Rate of hearing loss also by the age of 60 years, it is 1/3 of the people they are having hearing loss. By the age of 85, half of the people who are at the age of 85, they are having some hearing loss, or the ability to hear, it is 50%. Communication with older adults with hearing loss. When we are going to communicate with an adult with a hearing loss, there are some aspects that we have to follow up. If the person has bitter ear, sometimes you find that the person is hearing in the right ear better than the left ear. This is after assessment of the hearing in both ears. You have to sit or stand on the side of the more functional ear when you want to talk with your client. So try to be toward the side of the functional ear. When you are speaking, also speak slowly, distinctly, that the patient can understand what you are talking about easily. If your voice is high pitch, also you have to lower the pitch of your voice, because if you the higher voices, it might not be helpful for the client to hear. And also stand in front of the client, because they will read the lips. If the older adult doesn't understand certain word, we have to rephrase rather than repeat the word. So if you feel that you are talking about something and say, what you said, instead of repeating the same statement or the same word, you can use an alternative that the patient might hear it and understand it better. Face an older adult so they can see your facial expression and read your lips to enhance the rehearsal or keep the client view of your mouth, and the view of your mouth should not be obstructed. So we should not wear mask while we are talking with a client with hearing problem. Avoid wearing mask and being in front of the client in order to let him read your lips, because they will develop the skill of reading the lips. Communication with older adult with hearing loss, also help older adult to adjust hearing aid. If he is having some hearing problem and he is using hearing aids, you have to help them to adjust that hearing aids, because mostly as an old adult they are losing the manual dexterity. So those small things, they are having difficulty to adjust them. So find the fine motor dexterity is affected. Older adult also may not be able to insert the aid correctly to amplify the hearing. So we have to help them in adjusting the amplifier or the hearing aids and put it in place. Make sure that the hearing aids are turned on. Sometimes he might not hear anything because the hearing aids is put it off or the battery is very low. So we have to be sure that the battery is working and also it is put it on. If difficulties persist, check the batteries. Keep the background noise to minimum. Example, radio or television. So when we are communicating with a client, we have to decrease the volume of the radio or television if it is open there. So let feedback to monitor how much and what the person has here. So you can ask for a feedback from the client, what he understands from this session, in order to see how much he understands from it. Communication with all the adults with vision loss. The common problem of vision in older adult is cataract, glaucoma, and long sight. So cataract, which is obesity of the eyelids, the eyelids become oblique. It is not transparent, so he will not be able to see due to that the light does not reach the retina. Glaucoma, which is increase in the pressure of the eye. Long sight, that due to the cilia, which is become loose, and so the accommodation it will not be properly. So the patient will have a long sight that he cannot be able to read the near thing. Supporting independency of the visually impaired client. If we have a visually impaired client that he can see, but it is not that it is a difficult with a difficulty. So in this case, what we have to do, we have to help him with wearing his eyeglass, and the eyeglass, it should be clean. So we have to clean the eyeglass properly in order to be transparent and he can see through it properly. Also, stand in front of your client. Verbally explain all written information. Don't give him something which is written. If you give him, you have to read it for him. You have to explain what is there. Provide a bright light, but not glaring light. So it has to be bright light, but not a glaring one. Consider the font and letter size, using also space in between. Use a large print for them in order to be able to read it. About cognitive changes related to age, also in older adults, they have some changes in their cognition. It is minimal in healthy people. So in healthy people, even if they are reaching 100 years old, their ability of cognitive ability, the ability to understand, it might be still intact. But in patient with multi-disease, multi-disorder, also the cognitive ability, it will be decreased. But mental processing and reaction time may be slow. So the older adult, the response to stimuli, it will take time, because also of the affection of the nervous system and the sensory system. They are less likely to make guesses. They didn't like to make guesses. They may hesitate or not respond if they are under time pressure. If they feel that they have to respond within a short period of time, they might hesitate to respond. So you have to give them their time to understand well and to respond as they can. About 6 to 8% of older adults who are 65 years old and 30% of older adults than 85 years old experience dementia. So dementia or lesser memory, 6 to 8% of people who are above 65 years old, they are having dementia. And 30% of those who are above 85%, they are having dementia, loss of memory. Organic disease may lead to cognitive changes like toxicity. Toxicity due to many things, either toxic chemicals or toxicity due to recurrently having ketoacidosis, or toxicity due to improper function of the kidney. So it might be drug toxicity because of the accumulation of the drug effect in the body because it's not excreted well. Depression also. They are having depression if they are having multiple diseases. Metabolic disorder also, it is there. Assessment of cognitive changes. In assessment of cognitive changes, we have the mini mental state examination by Laston and Faustin. This, it will be taken mostly in mental health, mental health course. So you will be exposed to it longly in the mental health courses. Sorry. So this is the thing that we have to discuss. So also measure of the orientation, measure of the mental health state. It is concentrated in orientation, the level of orientation of the body, orientation to time, to place, and to people. Memory, recent memory and past memory. Abstracting, the ability to get the underlining of meaning of the language, and also language. There is also what we call it clock drawing test, that it might be there to used by those adults. Assessment of pain. Most of old adults, they are having ache, body ache. If they are sitting, they have big ache. They have to change their position in order to. If they are lying, also they are having some ache or some discomfort or pain. Why that happen? Because also the subcutaneous tissues, it is less. Because of that, pressure will be over the nerve, pressure will be over the bone when they are sitting, when they are lying. Also, due to the physical changes, the sensitivity of the nerve also, it will affect it. The degenerative effect also, and the endorphin or endomorphin, which is produced by the body, it will be decreased because of that. The pain sensation, it will endorphin. So the common concern of older adults being related to chronic condition like osteoarthritis also. This is which is related to the disease. Diabetes mellitus, peripheral neuropathy. Also, due to lack of mobility and lack of activity, constipation will be there, and it will lead to pain and abdominal distension, depression, dementia. Also, limit the older adult to report the pain because he is having dementia, so he is not reporting that he is having pain. Depression will cause also neck and shoulder pain due to depression. Drug abuse, also one of the public health problems among older adults. Sometimes they are using drug or strong analgesic. Face pain scale used for assessment of pain. So the pain assessment for all adults should ask the client the following: describe the quality and nature of the pain. So we have to ask them to describe the quality of that pain from range to 1 to 10. Identify when the pain occurs. Is it at night? Is it at daytime? Is it with activity? Is it when he is going upstairs? So what kind of the factor that affect the pain? Identify specific pain pattern and changes in pain intensity. If there is a change in the intensity, describe how the pain affects the client physically and psychological function. Does it affect his function? Or within the pain, he can tolerate the pain and he can do the activities of the pain? Define the area where the pain occurred, the site of the pain. How is the pain in order to help him to overcome it. Okay, thank you. This is for this session, and we will continue inshallah with the other session. Thank you.